Hi, and welcome to the show. Subscribe at kevinamy.com/podcast. Get CME for this episode by clicking on the CME link in the show notes. Today, we welcome back Heather Awad. She's a family physician. Her most recent Kevin MD article is titled, Be a Shining Example for Your Weight Loss Patients. Heather, welcome back to the show.
Thanks for having me, Kevin.
So, for those who didn't listen to our first episode together, just briefly share your story and journey to where you are today.
Sure. I'm a family physician by training, and these days I work as a weight loss coach online. I help professional women over age 50 lose weight for the last time. So that's my work now online.
All right. So, how's that going? What are some typical cases that you see and typical methods that you could provide online?
Sure. I work with professionals over age 50, and typically they're people who have done pretty well and been pretty healthy all their lives. And somewhere in the late 40s, they start gaining weight that they can't lose. And they start to think that it's impossible to lose weight because the old ways didn't work anymore. So I work with them a lot with their insulin cycles, trying to kind of reset their hormone levels through food choices and food timing so that they can understand how their body works. And then we just get them on a simple personalized plan, and they lose weight pretty easily. So it's really been fun.
So, when it comes to weight loss, there are so many myths that are out there. It's pretty much published every day in the media. What are some of the biggest myths about weight loss that you want to clear up?
Biggest ones are like eat less, move more, which I, personally feel terrible that I may have said that to someone in the past because a lot of it is food choices. Also for women over age 50, working on this insulin resistance and insulin cycles is really the magic for it. Also, another big myth is that you have to do it right all the time, or there are food groups you have to cut out. There are people that lose weight doing that stuff, but it's really not necessary.
So, before we get into your article, you mentioned the insulin cycle a few times. So, tell us more about that and how it relates to weight loss.
Sure. So, we use insulin, we eat and our blood sugar goes up, and insulin brings our glucose into our cells so that we can use this to nourish ourselves. But insulin is also a fat storage hormone. It tells our body to keep storing fat. So people in present day have food at every event, at every meeting. And there are also a lot of food pushers nowadays. Why aren't you eating something right now? Why? And people want to tell you to put something in your mouth. But the problem is that our bodies are made to eat and then have some time where we're not eating anything, even healthy stuff. So when we don't do that, then we become kind of glucose burners. We're burning all day long, and there's never a time where insulin gets quiet and your body naturally takes fat out to use as energy. And so that ends up being a really bad problem, and especially when you get to 50.
All right, we're going to talk more about that in your Kevin MD article titled Be a Shining Example for Your Weight Loss Patients. Now, how did your article come together?
Well, I was talking to some other family medicine doctors online in a social media group, and talking about kind of what are the challenges or what's difficult about taking care of people who are having weight problems. And a few people said, well, I don't feel like I'm a good example for my patients. And then, so how am I supposed to advise them if I feel like I don't know what to do myself? So I wrote this article for the doctors that asked that question. Because I think we do, there's a lot of shame and blame about it. And really, doing it imperfectly is better than doing it perfectly. And doing it imperfectly is also better than not working toward, a healthier lifestyle as far as eating goes.
So when you say that some clinicians aren't good examples, or they may not feel confident in terms of suggesting weight loss advice, what are some examples of that?
Well, I think people feel like they may also be in their 40s or 50s and having a difficult time losing weight, or they'll fall into the trap of trying to remake their whole eating plan. And then 3 days in, when it's so hard and so difficult, then it falls apart, and then they just kind of give up. And they get that feeling of shame, which is super common and comes from that kind of perfection that we want to have as doctors. And then they kind of feel like I'm falling off the wagon, and then they just kind of blow it as far as just eating junk and things like that, when really there's no wagon. And it's okay to pick one thing to try to make better, and then, little by little, you can add other things if that part is going well. Like maybe you pick one meal that you want to make healthier that will help you with weight loss. And you're not going to do it right every day, but you pick that meal and you do it right a number of days, and then you celebrate that you did it well. And our brains love celebrations of wins. And I think doctors also are not super great at celebrating our wins, because we're a little hard on ourselves. If you ate a savory breakfast most of the days out of the week, you should really pat yourself on the back or do a happy dance and then just kind of see what you think from there. But you don't have to redo your whole lifestyle all at once every minute of the day.
So celebrating small wins, stacking small successes. When you talk to other doctors about that approach, what's their response?
Some of them look a little blank, like, well, if I'm not going to fix the whole thing, because we're hard workers, right?
Yeah.
And we do hard things. And I would suggest that doing something more in a more mediocre fashion will actually serve you better. Do part of it, really celebrate when you do it right most of the time. Don't beat yourself up when you don't do it right all the time, because you won't. Things will come up, right? You'll go to work and you'll be like, I forgot my lunch today. And that's going to be okay. Because those little stumbles are super normal, and they actually won't wreck a weight loss journey. What wrecks it is giving up. I try to tell people, when I talk to really smart people, I say, go for compassionate perseverance. When it doesn't work, be compassionate with yourself, but keep going.
So for those clinicians in the exam room, sometimes in primary care especially, we just have so little time with patients, and there's so much that we have to do with patients and run through these checklists. So how can we be effective communicators when it comes to weight loss, especially in the primary care setting, when we're not like you, we don't just focus on obesity. There's so many other things that family physicians focus on in such little time. So what are some tips that you could share that can help patients with their weight loss journey?
Sure. I actually think that, if you are lifestyle focused, you can bring this in, because you'll do this even with people who have blood sugar problems or high blood pressure or cholesterol issues. And maybe you just ask them, like, is one of your meals, could you make one of your meals healthier during the week? What would that be? And they'll have an idea. And so if they bring up, well, I'm not sure about my lunch, then you can say, well, what do you eat? And then you can give them some suggestions and then say, okay, well, let's talk again in a month and let's see how this goes with lunch or whatever it is they've picked. Because it's funny, those little things will make a difference.
Now, when you talk to patients, what would you say are the most common pain points or points of resistance that you often encounter when you bring these suggestions up to them?
Sure. A lot of people are busy nowadays.
Yeah.
That's a tough one. And so we've gone for convenience, but there are fast ways to eat healthy. Things like bringing leftovers for lunch, or, having things in the fridge at work that work, knowing what backups are if you're out and about. When I think of like my favorite grocery store, I can go in there and I know there are 3 really healthy lunches I can just grab. I can grab a container of berries.
Sure.
I can get something from their salad bar, or they have cooked chicken already. Cooked chicken and a container of berries is a super healthy lunch, and really fast to get. So kind of allowing that this doesn't have to take up a lot of time, I think, is a real pain point. And then also, people feel like they have to like eat perfectly and work out a lot. And I just tell people when they're starting to lose weight to just forget about the workouts, honestly, because their exercise is really well proven for weight maintenance and not really well proven for the weight loss part. So it just adds another layer of complexity and perfectionism that just doesn't need to be there. So I just say, let's not even worry about the workouts yet. Let's just, look at eating some healthier foods and not eating all day long.
I want to ask about like medication options. We obviously hear about things like Ozempic and Monjaro and Wegovy. So I think that, patients see this in the news, and we have a lot of physicians who also have great successes from these medication. At what point do you introduce the potential of medications when it comes to a patient's weight loss journey?
Sure. Well, personally, I work online, so I work with people who are there to do it without medication. And I have even had people who have come after a trial of medication that they had side effects they didn't like. But I think it definitely has its place. The issue that comes up with it is people do best if they stay on that medicine forever.
Yeah.
So, that gets to be an issue. And some of the things that we work on with lifestyle are looking at when you're going to eat, am I hungry or am I not hungry? And, stopping then before you're full, just stopping like I'm satisfied, I feel like I've had enough. And some of those cues get removed from the medication. I've talked to some people who say, I just don't have any cravings. I'm not really hungry at all ever. I just eat a little bit. And that works. The hard part is that then if you're not on the medicine,
Yeah.
then you're kind of back to square one. And we
So,
don't want these medications to become the new
yeah.
yo-yo diet.
So you're absolutely right that if you go off these medications, the weight tends to come back. I'm seeing something of a reframing of obesity to more
Mhm.
of a chronic disease like diabetes and hypertension, and you just need to take your Ozempic indefinitely in order to keep the weight off. So, what's your thoughts about that reframing of obesity to more like a chronic disease?
I think it works, but I do say that we should individualize this to the person.
Mm,
You talk to who you're working with and decide what's going to be the best choice for them, because there are people who are willing to, look at more lifestyle choices and they don't know where to go with that. They would like some direction other than a weight loss program where they have to restrict calories or eat a special diet or something. So if they work with a weight loss coach who can help them with regular foods or a dietitian, some people are really motivated in that way. And some people are really just want the medication. And so I think you just have to work with your patient and see where that is. And then there are also people who come in and they're not doing well with their eating because they're depressed. Um, maybe they have food scarcity issues. There's a lot there. Find out what kind of the underlying root issue is going to be and what's going to help their health the most.
So you mentioned things like dietitian and weight loss coaches. So it goes to the point there are so many resources out there when it comes to a patient's weight loss journey. So many
Yes,
people, consultants that they can turn to. So talk about some things that you recommend patients look for if they need additional support when it comes to wanting to lose weight.
sure. Well, luckily, there are lots of people like myself who are weight loss coaches on the internet, and we have podcasts and social media feeds where you can find a doctor actually who is giving out information about weight loss online. And then next step, there are also more both lifestyle medicine and obesity medicine doctors who you can look up in your own local area that might also take your insurance. And you could have a medical visit with them and see if what they have to offer and to teach you might be in line with what your weight loss goals are and your health goals.
What are some red flags that they should look out for? Because you just go on YouTube, there are plenty of people who say they're doctors and they end up just wanting you to buy their product, for instance. So,
Right,
what are some red flags to look out for when looking for some of these resources?
right. Well, I'm glad you brought that up about people selling stuff because there are very few supplements that are proven. And I even have a doctor I was watching online and I thought, I usually trust her, but she's selling something now and I need to
Mm,
research it. So I basically tell you that someone who's selling something for you to eat is probably not the best choice. And one of the reasons I tell you that is that even people have like their little bars they sell or their shakes. And if you lose your weight with those, then you have to eat those forever
mm.
to maintain it because you really want to look long term. So I would say that someone who's trying to sell you something, a product that's going to be the weight loss thing, it's probably not it. You probably want someone who's going to help you with food, what you eat, knowing what a healthy eating day looks like, and is looking at your long term goals and is not giving you a short term plan because it's not, like you said, it's not a short term problem. You want to, one of the things I work with my clients is we talk about how we want to eat when we're done losing the weight
Hmm.
immediately because people will say, well, I'll just give up, pasta or potato chips until I lose the weight. And then I say, well, but aren't you going to want to eat that when you've lost the weight, and they say, well, yes. I said, okay, well, we have to figure out how we're going to do that the whole time so that when you get to your maintenance weight, you can just keep going and it's nice and simple and easy. And you're eating things that you like.
We're talking to Heather Awad. She's a family physician. Her Kevin MD article is titled Be a Shining Example for Your Weight Loss Patients. Heather, tell us some of your take home messages that you want to leave with the Kevin MD audience.
Sure. I would say, as a doctor, if you want to set an example for your patients, try some things. Maybe just pick one meal to make better and then share those wins with your patients and share with them the times that it doesn't work. Like, oh, I've been so good bringing my lunch to work, but some days I just
Mhm.
forget. So that they can understand that stumbles are part of the weight loss journey and that perfection is definitely not required for losing weight. But trying to build some healthy habits and then add more after those smaller ones become more permanent with you will help you be an example for your patients. It's a nice thing to share with your patients, those same eating issues.
Heather, thank you so much for sharing your time and insight. And thanks again for being on the show.
Thanks for having me.